Hi, Kelly.
Hi, Adam. I have a question about one of your patients today.
Who is that? Oh, no, you can't tell me. Don't tell me.
I won't tell you the name.
But you already told me. Because here it is.
Yes.
Yeah.
We know who it is.
But what's the question?
The question is, you were realizing that she had tightness around her kidneys, and you were relating that tightness with a possible reason for hypertension, and you were sort of bringing things together, and you were doing a kidney treatment. And I was thinking about when she first came in and how you focused on other things then, and I was wondering if you needed to wait until certain more surface level issues were resolved before you could go to the depth of working with her kidneys, or if there was something to that.
Yeah, good question. I don't think I definitely know, I didn't have any kind of like sort of theoretical framework about that in my mind. But it might be good to kind of just review her case and like think it through a little bit. So when she first came to see us, she was pre-diabetic with hypertension, allergies, swollen itching eyes, sluggish metabolism, weight gain, and the allergies in the eyes were really bothering her, right? So there was a lot of blockage in her Sun pulse on the right side for the sinuses, and basically I diagnosed that as sinus damp because the pulse felt kind of blocked but damp. And damp is a feeling on a pulse of like mushy, slippery, watery. Could be those are three different qualities, but all of them could kind of relate to a kind of a damp. Yeah, and then her stomach pulse was pounding. Oh no, that was her distal styloid pulse, which was pounding, which is probably from postnasal drip, because her sinuses were really going crazy. Her left shore was blocked. Her left sun was blocked. So at the time, my focus was on the allergies, right? Because that's her chief complaint, and it's a good idea to see if you can take care of the chief complaint when you see somebody. So, for the first time. So I put her on Sang-Artisan, Shin-San, Sang-Ju-Yin. Those three are used by Bob Doan. Where the Sang-Artisan and the Shin-San, actually they're very overlapping, very related formulas. They're basically working on the allergic reactivity, drying the sinuses from the excess damp. And then the Sang-Ju-Yin actually enters a yin tonifying element to that process. Because if you just dry the sinuses and they have an actual infection, you can trap it in there. You can trap the infection in there. So the Sang-Ju-Yin is anti-infective, also could be moistening, Sang-Ye is moistening, and so on. Ju-Hua has actually got a moistening quality too, other ingredients in there. Then I put on a little bit of Tongqia Huoshui Tang. Why did I do that? Because of the blockage feeling. It's not just damp, there's also some blood stagnation. There's some blood supply issues to her sinuses, which if you look at her, they're very small. Like she's got pretty narrowed nasal passages, and so we want to get more blood in there. That was pretty much the thrust of the formula. I also put her on Kushen and Lingjia for the wheezing. That was kind of connected a little bit to all of that. Some Longdan Shiegan Tang. She must have been angry. She must have been pissed off. Because a little bit of Longdan Shiegan Tang in there. A little bit of Baihu Tang actually, because I wanted to actually add more cooling action up there. And because I kind of love Baihu Tang. So I think that went pretty good, because that took care of the sinus issues. It took a little while. It took a few treatments and a few weeks actually, I think, to really turn it around. So following from that, let's see how we did there. yeah, everything seemed to improve. The sleep improved, but basically, once the sinuses were off the table and the allergies were kind of out of the way. Oh, by the way, a couple of treatments later, the allergies came flying back during a kind of hot, windy phase here. It was in August. And we added Feng Feng, Yuping, Feng San, and Bai Ji Li for the itching and for the allergic reactivity and the itching in the face and eyes and so on. That helped even more. Then, once that was kind of handled, it became obvious that the deeper reason for her being with us was something that I think wasn't even mentioned in that first treatment, was high blood pressure. And maybe more important even than that was the pre-diabetes and the inability to lose weight and the feeling of sluggishness and that kind of thing. So then we started focusing a little bit more in that direction. The sinuses in the eyes took a little while. We were working on it. And then, boom, after a month she was doing well. Now at this point, what the pulse showed me is blockage in the left jaw, which I'd been kind of ignoring, blockage in the left sun, which I then started to, really focus on. So blockage in the left sun would explain the sleep issues, right? And the general feeling of malaise. It's not an anxiety in her case, but it was more like a kind of malaise and sleep issues and fatigue, right? So I used Shui Fu Ju Yutang, and I used Bob's new 4 herbs for vasodilating the coronary arteries: Tian Ma, Mudan Pi, Zhizi, and Dan Shen. Very heat clearing, very heat stripping, really. And then Sheng Di Huang, a good dose of that for the pre-diabetes, and Sheng Chao Ping Wei San, just to help her digestion and to so she could digest the herbs too. So then I put her on a cleanse, right? Because it was really obvious to me that we had to do something a little bit stronger, that we weren't quite landing it. So at this point, my diagnosis for her also, putting her on the Shui Fu Ju Yutang kind of stripped some of the stuff out of the way. So then some other stuff became obvious, which is often what happens when you clear the excess, like in the original case, it was probably excess heat, damp with the infection. And then when you clear the excess and then you clear the blood stagnation, right? Then you start to see what's underneath. So what was underneath all of that was qi deficiency, blood deficiency, right? The blood stagnation is getting somewhat better handled, the damp retention is getting handled. So I put her on a cleanse, a detox, which was very good for her. And it seems like once she kind of really zapped through the cleanse, we got a lot of improvement. So the blood pressure came down when she was on the cleanse, which was really nice. Her blood pressure for a few days was 160 over 100, which is kind of scary. She has a family history of high blood pressure. And she started reducing her blood pressure meds when she was on the cleanse and so on. And she got down to the point where, I don't know if she's on any anymore. I don't think she's not. It was a gradual process of reduction to get her blood pressure meds down without her blood pressure peaking. Putting her on the cleanse. So when I say cleanse, here's what I actually meant by that for her. I put her on a cleanse called the Ajuva cleanse, EJUVA, if any of you want to look it up. It's an amazing cleanse if somebody is pretty disciplined, and she's nicely disciplined, which involves switching over to a raw food diet and then taking the cleanse, once a day for the first week, and then twice a day for the second week, and 3 times a day for the third week. And when you take the cleanse, you take out a meal. So by the third week, you might only be eating 1 solid meal a day, but lots of juicing, lots of vegetable juicing, lots of raw vegetables. And the Ajuva cleanse itself is a brilliantly designed cleanse, very effective for detoxing people. Why did she feel like she needed detoxing? And who needs detoxing, right? Well, in this context, in this Chinese medicine context, the patient seems to have a slow metabolism, right? And no matter what they eat or don't eat, they seem to not really be able to lose weight. That's actually a sign sometimes that you've got something stuck in that you need to kind of find a way to break through it, and a cleanse with fasting is really a great way to do that. Also, really consistent allergic reactivity, like what's feeding all that mucus? What's feeding all that mucus is a weak spleen, right? Because we need the spleen to be functioning really well to cut through mucus production, right? And so when people eat foods that produce a lot of mucus, or when they don't have a strong spleen so that they're more susceptible to foods producing mucus, then they're more likely to have chronic fungal sinus infections, which one American in 7 actually has. So when you see that kind of like a chronic infection, it doesn't have to be in the sinuses. There are like 7 places in the body where you're likely to see chronic infections, right? What are those? Sinuses, throat, digestive tract, all kinds of places, genital region. I mean, there's places where people get these chronic kind of things.
What about toenail fungus?
Yeah, that kind of thing too. So when you see chronic infections, that should point you in the direction of there's some detoxification needs to happen. If the person has a slow metabolism, the implication is they're not detoxifying. They're not pooping enough. They're not sweating enough, right? They're not like moving it out enough. If they're cold and they have a bowel movement every 3 days, they're probably also getting toxic at a certain point because things aren't moving. They're not sweating, they're not pooping. So that's another kind of indicator of that. She has this history of headaches, which I didn't even realize at first. It became evident once we were getting into the blood pressure treatment phase of this case that she actually has a history of quite a lot of headaches at times. And she's got this high blood pressure, right? So when you look at that, how little she eats, that she's overweight, with high blood pressure, with sinus infection stuff going on all the time, itchy, puffy eyes, headaches. Yeah, you want to detox the person. If you do detox them, you're going to get much better results. So one form of detox is through the diet, through cleanses. Another form of detox is using herbs. So in the herbal approach to detoxing, we use heat clearers and blood movers. That combination typically. And sometimes heat and toxin clearers, like Genren Homingyan, Sanjong Kwejian Tang, what is that? Shewei Lu Wei Qiyan. These are the formulas that clear heat and toxins. Very good for detoxing. Bob likes to use the heat clearers. I think he uses like his heat clearing for like Bai Hu Tang, for the the head and lungs and so on, and then Longdan Shegan Tang for the middle jiao, Zhebai Di Hongwan for the lower jiao, Bai Jiang San, so you pee out the heat. And then combine that with the astringents and combine that with Genren Homingyan and those other 2 that I mentioned. So that's another way you can do detoxification through the herbs as well. So she did about 3.5 weeks of detoxing and cleansing, and then it was like she hit a point and it was like, oh, she's actually getting fatigued and I can feel the deficiency. You don't want to cleanse forever, right? And it's time to start doing some tonifications. So I asked her to switch to a high protein, high fat, low carb diet, which she's been very good with. The headaches went away, the blood pressure came down to normal. The sinus thing seems to be a story of the past. She just had her blood work done, and everything had kind of come out normal. Like previously when she did blood work, there was it elevated liver enzymes? And hemoglobin A1C was up. And there were 3 things with the blood work, and let me see if I can find this in the notes. They all came back normal. They'd all dropped into the normal range. So she was a happy camper about that, and motivated. Oh yeah, another thing that popped up was flaking, peeling scalp and receding hair. It's interesting, you'll notice this when you start working on people. They'll come in and it's like, what's the problem? I've got a sinus issue, I got allergies, but clear that and they become aware of, or it becomes apparent that there's all these other layers underneath it, right? So now as of today, when we saw her, hang on, I'm not on today. At some point a few weeks ago, I got a better history. I got my head wrapped around her history better, which was endometriosis, some laparoscopic work, preeclampsia, fibroids. I have to confess that when I first did this case, I didn't write any of that stuff down, right? Because I'm like taking the pulses, telling her what's wrong, asking her if I missed anything. She's telling me what is on her mind. She did tell me about the hysterectomy like 5 years ago. But all that endometriosis and all that more detailed stuff I didn't get. But all I know was she had the left jaw blocked, and I wasn't like focusing on it. Not my clinical focus until where are we now? Like two and a half months later, right? So now today, everything's better. All the symptoms are better. She's doing well. The blood panels are normal. I don't think she's out of the woods yet. You know what I mean? She doesn't look at the appropriate weight for her optimal health, and I think that's been a story of the last, like many years. So she might not be fully expecting it, but I'm expecting that's gonna occur. So when I took her pulses today, what stood out to me as the only out of balance pulse was the left jaw blocked, and that's like the old history with the endometriosis and so on. That I think set her up for a lot of this. And she has this like family history of elevated blood pressure. She has elevated blood pressure. She's very chill. She's completely non-type A. She doesn't look like a liver, young, uprising, high blood pressure. She doesn't really look like a neck tension, high blood pressure, though there are some neck problems. She definitely could be a sinus issue blood pressure, but that's not necessarily all of what's there. So today I was doing channel palpation, and it occurred to me that it felt like her kidney channel was really blocked. So I started palpating around on her kidney channel and on her kidneys, right over her kidneys on bladder 21, 22, 23, 22, 23, something like that whole area, and looking at the kidneys and feeling the kidneys and feeling like how they feel puffy to me. Now, the kidneys can be a source of high blood pressure, and there's a specific formula from Jimmy Chung for kidney-related high blood pressure, which contains, I think it contains dujong, I know it contains li zhe he, was that lychee seeds or something, and it contains shui ding xiang. And it contains one or two other herbs, and I can't remember what they are off the top of my head. I'll have to look that up. But I was thinking about, that's interesting. It might be Sangji Sheng, but I might have made that up. And also Danshan would be a really good herb for her, because Danshan is really good for the microcirculation of the kidneys, but is also really good for blood stagnation in general. Her Cha pulse shows the blood stagnation, right? The blood stagnation is uterus, but she's past menopause. Is she past menopause? Yeah, I think she is. Yeah. She had a hysterectomy anyway, so, but she's also kind of at that point. So, where was I going with that? Yeah, she's past menopause, and so it isn't that blood stagnation, that endometrial blood stagnation is no longer evident in terms of symptom picture, but I think it's really an important part of what's holding the weight and the blockage energy in place. It's like a blockage, right? It's a giant blood stagnation blockage, right? In her belly, blocking the energy through her pelvis, and that reminds me of another thing. She has chronic hip pain, which I think is related directly to that blood stagnation, which that's what you'll feel on the left jaw pulse, blood stagnation. So my next thought for her is, maybe go after the kidney a little bit, but she needs to keep monitoring her blood pressure. She had forgotten to monitor it because it was just doing better, but I need to just kind of recheck it. Or maybe not, because, if her blood pressure is fine, I don't need to treat it, right? I was thinking aloud, because when I was working on her body, I felt the blockage in her kidney channels. So then I started palpating her kidney channels, right? All around kidney 9, lots of blockage, bilaterally. And so I was looking at the leg, the lower section of the leg as a mirror for the spine. So the area around kidney 9 was corresponding to her kidneys, which makes sense, just in terms of
holographic image.
Yeah, holographic image and sheet cleft of the yin wei channel, and just what we know kidney 9 can do for the uterus, right? How it reaches into the uterus region and all this blood stagnation that's there and her history with that. Kidney 9 was very interesting. I put 2 needles bilaterally in the nodular blocked regions of kidney 9. But then I was like, okay, so if the lower leg, I'm using the lower leg as a mirroring for her spinal region, then I can use the upper leg as a mirroring of her spinal region. And so what's equivalent kind of on the upper portion of the leg to kidney 9 is around the liver 9 area. And I don't consider liver 9 to be just a liver area. I mean, such a big zone. It could also be kidney. It could also be spleen, depending on where you move it and find it. So palpating there, same thing, but really dramatic reaction. Now, liver 9, yin bao, talks about the uterus, talks about the genital region, right? Because all of the channels of the liver go to the genitals, like the low channel, the divergent and the regular channel and all that stuff. And so liver 9, yin bao, which means the wrapping of the yin, which refers to the liver's, how the gallbladder wraps the genitals and the liver goes to the uterus and the genitals. It kind of refers to that. So lo and behold, the whole liver 9 area was like, it was so painful I didn't even actually palpate. I pressed 1 point on each side. Both times she jumped, actually, even though I didn't press it that hard, popped a needle. And that, I think, from an acupuncture point of view, should help to help the beginning of the process of unblocking, the blockage that's in the uterus region. Then to kind of keep working with that, I did these guys here, Muguan and Guguan. Especially, did I just do Guguan?
No, you did both.
I did both, didn't I? I like to do these if I want trying to open up the pelvis. It's so logical from again, hand mirror, right? Here's your body, well, that's where your pelvis is, okay? So then what I'm going to do with the herbs is I'm going to probably put her on like Jiu-Cheng Yin, Shaofuju Yutang. I'm gonna unblock the blood stagnation in her pelvic region. Maybe also some stuff like Sen Lang or Ju Wong Bu Liu Xing, something a little bit more like pointed in, Maybe some bugs too. Some bugs would be really good actually. I think she's a devout vegetarian, so we should probably try and stack a lot of bugs in there. Kidding. So anyways, yeah, this treatment course is going well, except that now we have some deficiency underneath all of this. That's why I added So Tang into the formula. I gave her a bunch of So Tang to take, to just add it in, like send a little bottle to add into her other bottle, because it became evident to me that underneath all of this excess stuff, once you cleared the excess, there's the qi and blood deficiency as well. So I will continue to tonify her blood, and I'll probably tonify her qi too. I'm not, I have to think about what's needed with that. Yeah. So why is the treatment working for this patient? Because she takes the herbs twice a day, and because she follows the dietary advice. Yeah. Okay, that's it.
Thank you.
You're welcome.
Great.